Hi all, this is an update on the community pharmacy consultation service. Today we will discuss the GP referral pathway.
The aims of the service are around diverting patients with lower acuity conditions to community pharmacy. The pharmacist is the first port of call for these customers. This in turn will reduce demand on other urgent care settings, and patients will be able to appropriately manage their health better. The other aim of the service is to appropriately manage patient requests for urgent medicines or appliances. The requirements of the service are set out in the service specification. The major requirements are around clinical governance processes being up to date, the pharmacist being able to access the summary care record, and the pharmacy having access to the NHS shared mailbox and it being used on a regular basis. The consultation room must be a confidential area where the patient cannot be overheard, and a computer must be available. SOPs must be signed and read by all team members and reviewed annually.
The work we did earlier on the minor illness and urgent care referral pathway is available to watch on YouTube. Simply type community pharmacy consultation service and click the video by Knight's Pharmacy. Now let's talk general practice referral. So from the 1st of November 2020, Cpcs was extended to general practices as well as from 111. The way it works is when the patient contacts the general practice, either remotely or in person, and seek an appointment from their GP, the patient is immediately assessed to determine if their reason for presenting is suitable for referral to NHS GP Cpcs. Now, the service specification details all the conditions that you could refer to community pharmacy for. The general practice then refers the patient via an electronic method. In most cases, this is NHS mail. So you won't necessarily see the referral directly on Pharm Outcomes from most practices. And the reason is most practices do not have that EMIS referral pathway. So some practices may refer directly via Pharm Outcomes, but other practices, and certainly in most cases, they are using NHS mail as the referral pathway. What you then need to do is take that data from NHS mail and then put it into Pharm Outcomes separately. And on the left-hand side of Pharm Outcomes, you will see GP Cpcs. You then click on that, register the patient, and follow that client conversation through. So only patients who have been referred by their GP practice are eligible to receive the advice and treatment under Cpcs. Patients presenting in the pharmacy for minor illness or any other conditions would then get treated in the same way as if they were appearing in the community pharmacy on a general day-to-day basis. You can't then ask them to go back to their GP simply for getting Cpcs. That's not how it works. So the pharmacist will assess the patient, considering any red flags with regards to NICE guidelines and the Green Book and so on. And really, there are various pathways they could then follow. You could either just give advice, you could give advice and sell something over the counter, or you could refer on to the locally commissioned minor illness service, or you could actually refer on to another service which you may be providing in the branch, for example, extended tier 1 services like UTI, etc. Really, really important. The conversations I've been having with general practice teams is they're only going to refer Cpcs to pharmacies which are doing additional services, because they then know that they're less likely to get a referral back into general practice. So a lot of the pharmacies that they refer to will be pharmacies already providing existing services, whether it's an umbrella service or whether it's tier 1 services like, for example, UTI or acute bacterial conjunctivitis, etc. Very important that your pharmacy is already providing additional services which are locally commissioned so that they can then accept a GP Cpcs referral without needing to refer back to general practice. Okay. Once you've completed your consultation, you may then perhaps, depending on the pharmacist's discretion and depending on the needs, have to basically inform the general practice, and that can be through an agreed method such as NHS mail. And it's really, really vitally important that branches are using NHS mail on a regular basis each and every day. Okay, so let's just double check and make sure we fully understood. So the patient calls or attends the GP practice with a minor illness. The patient is then triaged to see whether they're suitable for community pharmacy, and a message is sent to the community pharmacy via NHS Mail or via Farm Outcomes. The pharmacy picks up that referral, contacts the patient, or the patient presents in the pharmacy. The pharmacy must respond within 2 hours. So the pharmacy, as soon as they get that referral, within 2 hours should make attempts to contact the patient. Okay, and there could be various ways that could then be followed. Either the pharmacy hasn't received that referral, so if, say, a patient presents and the pharmacy hasn't received that referral, they could then basically speak to the GP surgery and say, hey, you've sent a patient over to us, we haven't received that referral, could you please resend? Yeah. The other way is that the patient is uncontactable. Which is, you then basically just have to inform the GP surgery that we've received this referral, but we've not been able to contact the patient. However, in most cases, the pharmacy will consult the patient, and as discussed previously, you could either give advice, and a service, or you could give advice and refer to a service, or you could give advice and provide OTC medication. There may be times where you may be required to escalate the matter in urgent situations, and that's when you can refer to 111 or directly to the GP. So the important thing about GP CPCS is really focused around pharmacies that are providing additional services, and I can't stress that enough. These are the pharmacies that will be first line for referrals from general practice into community pharmacy. From a claiming perspective, it's still being claimed via MYS, just like CPCS 111. So even though you've entered your data onto Farm Outcomes, you will still need to, at the end of the month, claim it on MYS. So a final message from me: you must always check your NHS Mail shared mailbox. If you're off, you must make sure that a deputy is in place to always ensure that that is checked. Farm Outcomes must be regularly checked each day, and you must ensure that all of your locally and nationally commissioned services are being provided in the pharmacy.